Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Welcome to Health for Life. Today we're talking with Melinda Edgeman, Director of Women's Services at the Turner Maternal and Infant Care Center at Hamilton Medical Center in Dalton. Melinda, thank you for coming on our show.
Thanks. I'm glad to be here.
So today we're going to talk about one of the most inspiring programs at Hamilton Medical Center, and that's called Build a Brain. And Melinda, could you tell us what the Build a Brain program is all about?
It's an early childhood brain development initiative that empowers parents from a baby's very first days. It focuses on how everyday interactions like talking, reading, singing, and holding the baby, it helps build those babies' brain connections. Our goal is to make every parent feel confident that they can influence lifelong learning and emotional health starting right at birth.
Where did the program come from and how did it get started? Because I'm honestly, just now hearing about this.
It's a national program. Some local community agencies came to us and asked us if we were interested in this. We're currently doing a Call to Talk With Me baby book that we give out, but this is a program that really helps to develop the brain early, because early brain development, 80% of it is done by age 3. So what this program does is it really helps teach parents to talk to babies just in basic everyday stuff. Say, I'm going to fix your food right now. These are carrots. And just things like that help to build the baby's vocabulary and its brain.
I'm sure we might get into this later in the show, but just thinking about just talking to a baby, I've always heard debates about whether just to talk to it just like this or to put on a little bit of a voice. No,
just talk normal, So today we're going to go to the grocery store, and then after the grocery store, we're going to... No, the voice doesn't.
Okay.
I mean, you can, people do, but it doesn't have any impact. It's just the talking itself.
I've always wondered about that. And with this Build a Brain program, what kind of information will new parents get through it?
So they have a video that they'll watch, and it'll kind of explain to them the importance of talking to their baby, and it will provide them an opportunity to sign up for information that will continue to come to them as the baby grows for different milestones that they can be aware of, that, at different ages, things that is expected for their child to do, so they can help work with the child to meet those milestones.
Why are the first 3 years of development so important?
That's when they really build all of the brain connections. And if you put a kid in a car seat and leave it while you're on your phone, it's very quiet, and there's no stimulation, and there's no opportunity for the baby to start picking up words. And so it's amazing the number of words that a baby's going to learn in the short period of time, unless they're not being spoken to.
I'm sure that you've seen so much change with technology becoming more mainstream, which is, giving it to the kid, hey, sit back there and, use your iPad or something.
And it's very convenient, especially when there's things going on, but we've lost that. That's created this issue to where we're not spending the time and speaking with our babies and talking to them.
How do families respond to the program when they go through all this?
Initially there's some, they're not sure, but I think they seem really excited. So it's still fairly new, but so we're still working out some kinks and trying to get some things started. And the fact that it's bilingual.
Is it only for new parents, or could any family just show on up?
Well, we are partnered with First Steps in Healthy Families. They're a local community agency that already comes and sees our new moms in the hospital. They also have a home visitation program. So they could probably help. They may already be involved. They could help them learn more about this program. And they're always welcome to come to the hospital, and we can always give them the QR code and get them, started.
Yeah, speaking of the hospital, how do nurses and staff all work together to actually support this?
So we've done some training, and we've talked about it. We've had multiple years of training on the importance of talking to the baby. So we give out a book that talks to them about how to simply talk to the baby, things to say, some examples just to try to help encourage them. And then we also give a book that's the Build a Brain book that talks about the different milestones and things that to expect at different ages. So we go ahead and start talking to the parents, the grandparents, anybody else that's in the room that wants to participate, and just to say that basic stuff. When you're changing the diaper, tell them what you're doing. When you're doing this, just talk to them. It sounds very basic, but it's a lost art.
Yes, and you've been there since the inception of this program.
Yes.
And what's been your most favorite part of it so far?
I I think is for me, in all honesty, was realizing that that was a problem. And so I think, again, in the days of social media and cell phones, we've gotten away from that.
If somebody attends this program and they finished it and they want to learn something more or go somewhere else, where could they go to get some more information?
I think our community agencies, the Family Support Council, they have lots of programs, and that would be a good place that I would recommend that they start.
Do you find that a lot of families do seek out more information once they realize how important it is?
Yes, they do. It can be overwhelming, and sometimes you only know what you were taught or the way you were raised. And so there's lots of resources out there.
I think, I'm not a parent, so I don't know, but I feel like there's a lot of moments where you think back to how you were raised maybe wasn't the best way on how you should raise your own kid.
Or you realize the way you react to something is maybe the way one of your parents reacted. Whether that's right or wrong, that's the only reaction that you know. So we do learn a lot from our parents and the family that we're around as we grow up.
Exactly. And thank you once again, Melinda, for just joining us and introducing the Build a Brain program to us, because, with this being so new, it shows that love and connection literally do grow the brain.
Yes, thank you very much.
To learn more about Turner Maternal Infant Care Center at Hamilton Medical Center, please visit hamiltonhealth.com/women.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.